Welcome to the Med Madness channel. Today we're diving into Zenker's Diverticulum. This is a pseudo-diverticulum of the upper esophagus, located just above the esophagus at Killian's triangle. It commonly affects older adults and can lead to symptoms like dysphagia, regurgitation, halitosis, and a risk of aspiration. In terms of pathophysiology, Zenker's diverticulum results from increased intraluminal pressure and dysfunction, primarily at Killian's triangle, involving only the mucosal and submucosal layers. Clinically, it presents with difficulty swallowing solids and liquids, regurgitation of undigested food, bad breath from retained food, and a risk of aspiration leading to pulmonary issues. Diagnostic approaches primarily include a barium swallow study, which is the preferred method that shows outpouching. Endoscopy is used with caution due to the risk of perforation. Treatment options vary from observation for mild cases to surgical options like open neck surgery for severe cases or less invasive endoscopic stapling. Lifestyle adjustments also play a crucial role in managing symptoms. Please like, share and subscribe to the Med Madness channel for more insightful medical content.